I'm Dr. Vishakha Munjal. I'm a laparoscopic surgeon and infertility specialist. Today I'm going to talk about role of laparoscopy and hysteroscopy in treating infertility. Today infertility has almost become an epidemic. This is because of multiple reasons like late marriages, late planning for pregnancy, various diseases like tuberculosis and pelvic infections which affect the fallopian tubes and cause their blockages. Then there are certain diseases like endometriosis and fibroids which are at times the reason for infertility. These days, lifestyle changes and increase in stress levels is also one of the major reasons for ovulatory dysfunction and decreased sperm count. Couples facing infertility should consult an experienced gynecologist to understand the reason for the infertility and how best it can be solved. Laparoscopic and hysteroscopic fertility enhancing surgeries can greatly help in diagnosing as well as treating many factors of infertility, thus helping a woman to conceive naturally. Also, certain conditions like fibroids, endometriosis and tubal factors like hydrosalpinx need to be treated prior to IVF to increase the success rate of IVF. Else the woman will go on undergoing multiple cycles of IVF and will get no results. So it is very important to treat the diseases prior to undergoing IVF. The major fertility enhancing surgeries are: number 1, fibroid removal, which is also called myomectomy. Almost any size of the fibroid can be taken care of laparoscopically. Compared to an open surgery, laparoscopic myomectomy has lesser blood loss and it leads to lesser adhesion formation. It is also less painful for the patients. Patients can return back to work more quickly and they can plan for pregnancy also more quickly. Then there is endometriosis, which is a chronic painful condition which causes severe pain during periods and during sex along with infertility. It is one of a very major reason for infertility in today's age. It is also associated with cyst formation at times, which is called a chocolate cyst. Laparoscopy in fact is a gold standard for treating endometriosis. After endometriotic surgery, a woman gets not only relief in her pain, but also she is able to conceive quickly. Then there are certain ovarian cysts which at times are a hindrance for conception. Any size of an ovarian cyst can be treated laparoscopically. With removal of ovarian cyst, we first of all get an histopathological diagnosis to rule out any malignancy in the cyst, as well as we remove the hindrance which is coming in the way of conception. Then talking about tubal factors, tubal blockage at any level can be treated laparoscopically. And if the blockage is at the starting of the fallopian tube, there are very fine cannulas along with guide wires available which we use to cannulate the fallopian tubes, and this can be done very effectively and it increases the chances of conception naturally. Now let me talk about hysteroscopy. Well, hysteroscopy is a small telescope which is passed into the uterine cavity to see the cavity from inside for any pathology and to see the opening of the fallopian tubes. Certain factors like presence of a fibroid, a polyp is sort of a growth inside the uterine cavity, a septum which is like a wall causing a partition inside the uterine cavity, they all can be resected hysteroscopically. Once this thing is removed hysteroscopically, the chances of conception of a woman increases greatly. All in all, laparoscopy and hysteroscopy are a boom for infertility management. Laparoscopy is technically a much superior procedure than an open surgery. Since it is done through small punctures, it is cosmetically very appealing. It causes less pain, less blood loss, less hospital stay, early recovery and early return to work for a patient. If you wish to contact me for any laparoscopic enhancing surgeries or infertility related problems, you can contact me at Mediclinic E16 Lajpat Nagar 3. Thank you.